Okay, thank you, everyone. Hopefully, you enjoyed our last two or last session within it. As we kind of conclude, we've had a lot of discussion about policies and impacts and ways that we're going to be redefining health within our rural migrant communities. A couple things that we just want to talk about as we're wrapping up. As a center, some of the initiatives that we put together in the last year was our Brown Bag series, where we've discussed a lot of issues facing our communities, from homelessness to had Zach, who was on our panel this morning, talking about the policies and impact on our communities, to how we build community academic partnerships. Our next one is going to be Jay McCann, who is faculty here at Purdue. If you use the QR reader, you'll be able to register for that event, and that's October 21st. We always have him over the lunch hour, looking at civic engagement among our Latino immigrants. And then we will also have, after that, sorry, moving a couple of things around. Dr. Cody Mullen, we will do an update on policy and rural health in November. And part of this is, as Carrie talked about this morning, that with the bills and the need to get budget set by the end of the month, there's a lot of things that are still in flux. And if we go into a CR, continuing resolution, we'll kind of kick the can maybe another month or two, but you can only kick the can so far. But Congress is very good at that. And so depending on what new things have come out for related to Medicaid, or looking at how we structure a lot of governmental agencies and how is this going to be impacting rural policies as well. So Cody will lead that conversation too. Things also is we have a LinkedIn page. You can use that QR to get into it. Please follow us. So we'll be sharing lots of job opportunities, trainings, things that come from our community partners. If there are things within your organizations or for student groups want to post, please let us know. We'd be happy to share that on your behalf. We've also implemented some networking sessions. And so if you're a faculty member and do work in the rural migrant space and have an interest in that area, you can sign up to be a faculty affiliate. And that information is available on our website. This year, we awarded two $15,000 pilot grants. One is a partnership between faculty and Purdue Extension looking at food insecurity within our rural spaces. And then another was a partnership with Speech, Language, and Hearing Sciences and other faculty that are looking at taking out into the community to do mobile screening within some of our rural communities, understanding especially the impact of big agriculture, working around large machines, and hopefully you got to also interact with Agribility during the poster session, who really does a lot of fantastic work in making sure that agriculture work is accessible to all. Like you saw here with Dr. Douglas, we've had the opportunity to be meeting with local health officers to develop programs. So within Montgomery County, we're currently doing a very exciting public health issue led, probably the least controversial of all the public health issues we have, but developing a screening campaign to increase community-led screening for young children. If we think about a lot of our rural communities that do have dilapidated infrastructure, older homes built before 1978, that we have a lot of lead exposure in the paint in the house, but also a lot of the work that we do. We have men and women who are going to work and then bringing lead unknowingly on the bottom of their shoes into the household as well. And so how can we increase lead testing as well within it? So as we kind of go forward, as we wrap up today, I want to kind of extend my deepest thanks to all of you, really, for your presence and engagement. We've had a lot of lively conversation from the panel to our breakout sessions. And whether you're a community leader, a student, a faculty member, or practitioner, your participation is what makes all of this quite meaningful for us. I also want to thank a lot of our panelists had to catch flights. It's Friday, they want to get home and beat a little bit of the rush hour, or what we probably call here at Purdue rush minute traffic, to get out within it, but really to thank them for the rich conversations they have had with us today, some of this was challenging. We didn't always hear the silver lining in everything. We know it's going to be a rough road for a little while within a lot of our communities. There will be a lot of opportunities and a lot of opportunities to rebuild and rethink and to innovate what healthcare looks like, what public health looks like, what policy looks like in general, and we have to be forward thinking within it. And we know that the dialogue that we've been having has to go beyond these walls. And so at Purdue, we see this symposium as not just a one-time event, but as part of an ongoing conversation. So as I kind of shared our two upcoming brown bag sessions, where we will continue to share research ideas, strategies, and informal interactive settings. And these sessions are really an opportunity to stay connected and deepen relationships that are so critical to our collective work. Today's discussions really underscored the reality that we are operating in a rapidly changing political landscape. Policies at the federal, state, and local levels are shifting quickly. One participant in our last session talked about how health departments don't know how to kind of react. And I think part of it is, and I always tell my students too, when we know the rules, we know how to play the game. But with the absence of rules or constantly changing rules, we're not able to navigate within it. Sometimes we have to take a very Machiavellian approach and understand and work within systems when those systems are constantly evolving. That's something we also have to evolve with as well. And so as these do shift quickly and they have direct consequences for our rural and immigrant and migrant populations who work in those rural spaces, these policies touch every aspect of life, from access to healthcare to housing, education, labor protections, and more. As community members, professionals, and advocates, we have such a huge role to play. And I encourage all of us to engage with your representatives at every level, local, state, and federal. I heard a lot of students talking about becoming members of National Rural Health Association for a cheap price of $20. We were joking that maybe we should get a commission for every registrant that we get within it. We know that policy change doesn't occur within vacuum. The behaviors and the health of our communities also don't occur within that vacuum. In order to change policy, we have to organize and we have to advocate for what matters. And it's not optional, it is essential. It is through advocacy that communities bring their needs forward, hold leaders accountable, and create lasting change. I think another theme that emerged today is the shifting funding environment. We know that community organizations, many of which are the lifelines of rural migrant communities, are facing shrinking budgets and increasing demand. Too many of these organizations are being faced to scale back, or Dr. Mullen and I were just out in Oklahoma, and a lot of these entities are having to close their doors. Groups that have been 20, 30 years who have really relied on federal funding to do their work. And within that, those organizations aren't going to be able to bounce back once the funding does return. And it will return. It may look different. Those losses are deeply felt, and they remind us of the urgency to build stronger partnerships between the community and academic institutions. Neither can achieve health equity alone, but together we can leverage resources, share expertise, and sustain the vital work that supports our communities. As we look toward the future, let us take the energy and insights from today and carry them into our work. Let's continue to collaborate across sectors, listen to the communities we serve, and advocate for policies that support health equity and dignity for all. And let us remember that while the challenges are great, so too is the collective power in this room and the resilience of our communities. Rural communities, immigrant communities are very resilient and overcome so many things. So thank you all for spending your day with us, for the work that you do in your communities, and for your shared commitment to advancing rural migrant health. We look forward to staying connected and seeing you at next year's symposium. So with that, thank you all.